California's first coronavirus death intensifying the crisis tonight. Governor Gavin Newsom declaring a state of emergency after a patient died of the virus at Kaiser Roseville.
Health officials say that patient was a 71-year-old man with underlying medical conditions and traveled on a Princess cruise ship last month, which left from San Francisco. Now, tonight, the governor is taking action to stop that ship from docking in the bay.
That ship is now being delayed to provide ample opportunity for the CDC, partnership with Coast Guard and with state health officials to conduct tests.
And with that, lots to get to tonight. Thanks for joining us. I'm Tony Lopez.
And I'm Adrienne Moore. CBS 13's Rachel Wolf is live for us at the state capitol tonight. Rachel, what have you learned?
Well, 2,500 Californians are on board that cruise ship, and some are showing signs of the coronavirus, and that's why that ship is being delayed, which you just heard about. Now, let's talk about how this all happened, right? The timeline of events. So we do know that a person in Placer County has died from the coronavirus. Well, we are told that that person who died was on that same cruise ship, the Grand Princess, when it set sail from San Francisco to Mexico in late February. It returned, and the passenger got off, and then it boarded up again and shipped off to Hawaii. But when people started getting sick, that's when the governor decided to declare a state of emergency, and the ship was delayed, and the CDC is now flying in coronavirus test kits.
We would be neglectful if we didn't consider those protocols with a different sense of urgency. I mean, there's just the magnitude of having a manifest with thousands of individuals, of which a majority are residents of the state of California, and of course, then the rest all across the country, for that matter around the rest of the world. That's in addition to the number of crew on this ship, I think do require different protocols and procedures.
So what does declaring a state of emergency do in the state of California? It does this, just as it does everywhere. It advances resources, it streamlines efforts between agencies, it allows it easier to quarantine people. It also brings in people from other parts of this country who can help with this health scare. So there are lots of other things that it helps with, but those are the keys. And then in terms of funding, this is a big one. It allows funding. Now, the governor says we're flush with money at this point in time when it comes to this, because Congress actually approved $37 million in emergency funding to deal with this crisis in the state of California. And he said that he's taken $20 million from the rainy day fund in order to deal with this. So again, this is evolving. A lot of people watching how the state of California is going to be dealing with it.
Yeah, pretty rare for it to be declared for a health emergency, that's for sure. Rachel, thanks. Live at the Capitol tonight.